Today I want to talk to you about PCOS, or Polycystic Ovary Syndrome. So let's get to it. Hi everyone, this is Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Polycystic ovary syndrome is the most common endocrinologic disorder affecting reproductive age women. It can actually affect 10 to 15% of the population, but some data suggest that there's a higher prevalence, approximately 20 to 30% of those women living in the developed world. And there's even actually some studies that suggest that 50 to 60% of South Indian women in Britain are affected with polycystic ovary syndrome. Why is this so important? Well, it's actually the biggest cause of ovarian infertility and abnormal uterine bleeding among reproductive age women. The reason why this is important is because it increases a woman's risk of heart disease and cardiovascular disease in the future. The other curious thing about this disease pathology is that it's also associated with other sources of gynecologic problems that can develop later for women, including endometrial polyps and uterine fibroids. So let's talk about the background. What is polycystic ovary syndrome and how is it defined? Well, there is a big criteria called the Rotterdam criteria. It is defined by 3 criteria, and you must have 2 of the 3 to fit. The first one is irregular periods. The second one is evidence of testosterone excess. And what does that mean? Evidence of testosterone excess means losing hair or hair where you don't want it, maybe on your chin and maybe on your belly, and cystic acne. The third criteria is very tiny, small ovarian cysts seen on ultrasound, usually less than 1 centimeter in size, in what's called a string of pearls. And they will outline the ovary, kind of like a string of pearls on the ovary. Now, you must have 2 of the 3 to fit the official criteria of PCOS. However, everyone's a little bit different, and it is just a syndrome. And a syndrome means that sometimes there's features that come and go. And so while you may have had irregular periods in the past, but now you only really have some acne, and then maybe your period was skipped last month, but then it returns. So sometimes there's what is called phenotypic expression that looks different. So everyone's expression of what PCOS characteristics will look a little different, and not everyone fits the same criteria. Now, the exact cause of PCOS is largely unknown, but most of the time it's related to too much insulin. Now, what's insulin? You probably have heard of insulin in the form of talking about diabetes and hypertension and those kinds of things. And what does that have to do with it? Well, it has to do with the same things I was talking about in the beginning. We do know that PCOS will increase your risk of having hypertension and diabetes and cardiovascular disease in the future. And it all comes down to insulin. Insulin is the hormone that is created from the pancreas, and it's used to modulate or shuttle different sugar molecules in your blood system. However, insulin is also a stress hormone, and it will increase and come and go and rise and fall depending on what's going on in your life. So let's talk about how insulin plays a role. If there is an extra amount of insulin in your body, that usually has to do with some carbohydrates that you've consumed, okay? But certain triggers will increase carbohydrate consumption, and if there's too much of this consumption or external stress in your body that raises insulin, it will end up causing higher levels of insulin that chronically over time will affect your ovulatory system. Well, how does that work? Well, excess insulin will directly affect your ovary, and your ovary will start to produce something called androgens, which are the testosterones, okay? And these androgens will affect your liver, and your liver will start to decrease something called sex hormone binding globulin. And sex hormone binding globulin is a protein that's created by the liver that will actually circulate through your bloodstream and fasten on to active hormones that are circulating through your body. When it fastens to them, it actually kind of neutralizes them so they don't have their free effect. But because there's a decrease in sex hormone binding globulin in PCOS patients, there's more free testosterone or androgens circulating through your body. What ends up happening is that those extra androgens start to affect your brain in an area called your hypothalamus. And your hypothalamus is the area of your brain that actually sends signals to your pituitary gland to allow ovulation to occur. But if there's too many androgens, that actually inhibits the pulsatility index of a famous hormone called GnRH. And GnRH is what activates the anterior pituitary gland from stimulating something called luteinizing hormone in the appropriate way. So when there's too much luteinizing hormone, this will cause a imbalance of luteinizing hormone with something called follicle stimulating hormone. Okay, so let's get into the mechanism of polycystic ovary syndrome. Now, the first thing to really remember is that polycystic ovary syndrome appears to be inherited as a complex disorder in which several genetic variants are present, but together they all contribute with lifestyle and environmental factors that create the manifestation of this disorder. And so everyone's a little bit different on how they manifest this. Some people have more acne, some people have a little bit more hair in their chin, some people have more irregular periods. It really just depends on what the environment and how your genes play a role. So going back to how the mechanism of action is created. Well, it all starts with insulin, and insulin is the big modulator here. So what ends up happening is elevations in insulin and a feature called insulin resistance cause something called hyperinsulinemia. And hyperinsulinemia will directly affect the ovary. The ovary will then start to produce some hormones called androgens, or another word for them is a class of testosterones. These testosterones will affect your liver. It will cause your liver to produce less of a hormone called sex hormone binding globulin. However, once it binds them, it actually destabilizes them so they don't have too much of an effect on your system. But if there's less of it, then there's going to be more circulating testosterone floating around your body to do its effect. And that's what causes a lot of the unwanted features of PCOS, like acne and hair where you don't want it. This extra androgen or testosterone will start to affect an area of your brain called the hypothalamus. Now, the hypothalamus is what secretes a very special hormone called gonadotropic releasing hormone, or GnRH. Gonadotropic releasing hormone is a really interesting hormone that will be secreted in pulses. And if it's not secreted in pulses properly, then it will affect your pituitary gland. And that is really important because if it is not secreting and affecting the pituitary gland appropriately, then a special hormone from the pituitary gland called luteinizing hormone will not be secreted in the proper way. Now, going back to hyperinsulinemia. The elevations in hyperinsulinemia will also affect the ovary to produce extra levels of estrogen. This also negatively impacts GnRH and the anterior pituitary and will decrease the amount of follicle stimulating hormone. This is really important because follicle stimulating hormone does exactly that. It starts to stimulate the ovary to create a follicle, and the follicle is where the little egg lives. If there is not enough FSH, or follicle stimulating hormone, then your ovary becomes arrested in follicular phase, and the little ovary will end up developing small follicles less than about 1 centimeter size that will get ready to ovulate, however, never do because they never receive the proper modulating GnRH pulsatility index that leads to LH surge. And LH surge is what causes ovulation. And so because of that, your body will be arrested in something called follicular phase and will never ovulate. And this is what causes one of the features of PCOS, of irregular periods. How do we fix all of this? What is the way to improve PCOS? Well, going back to insulin, and insulin is really the big hormone that modulates polycystic ovary syndrome. So if you can reduce your insulin level, then you will be able to remove the arrest of follicular phase of your ovaries. And it just comes down to that. Now, it's easier said than done, right? I can show you the physiology of how all of this works, yet reducing insulin levels is really tough to do. Sometimes it can be something as easy as stopping processed food or decreasing carbohydrate intake, but sometimes it's even more complex than that because a lot of things will raise insulin levels. If you want to, you can go and check out one of my videos that talks about all of the different things that raise insulin levels. But the key thing here is that I want you to understand it's that insulin rises, and when insulin rises, it really changes your ovulatory cycle, which leads to all of the different things that we talked about. If you found this video helpful, please feel free to share it with a loved one. Also, remember to hit the notification button and subscribe to make sure you don't miss future uploads. Thanks for joining me. I'm so glad that you came.